Hi, I'm John from Canadian Sharing Locally and Globally. I'm here today with Professor Balaji, who is the head of the Sri Narayani Hospital and Research Center in South India. He's here today to talk to us about the community health outreach camps that are conducted regularly.
Yeah, it's a great opportunity for me here to join, and thank you very much for Amma as well as the Canadian Sharing for giving me this opportunity. Yes, we are doing a outreach program. Actually, our hospital is located in and around 36 villages. That is rural area. We are located in the rural area, and we are adapted around 36 to 37 villages. So what we are doing every week that we are organizing a health clinics in each village. What is the necessity of the health clinic in each village? Why not they can come to the hospital? Yes, many patients they don't want to come to the hospital because they think they can have the native medicines and they can live as long as they like. But what's happening here, like when we go to the village and we are newly diagnosed many diabetes patients, many hypertension, many cholesterol patients, even we found many patients who is having the cancer issues also there. How it's happened, like even the patients with the diabetic wound, he don't know what is the wound, but he is keeping all the native medicine, like he will keep the charcoal, he will keep sometimes the toothpaste, tooth powder, everything also they can use. But at last their wounds are getting worse and worse. When we go to the village and we found those patients, and our physicians immediately asked for the test of the blood sugar test. When we found the sugar level is very high, but they don't know why the wound is there. After that we will tell them, because of your high level in sugar, your wound is not getting cured, it's not getting healed. So definitely you have to undergo the various tests and have the medication. Only by that your wound ulcer will get healed. Like that we'll explain them. Similarly, we go and found many patients with heart disease. When they are having a high blood pressure and cholesterol, they're thinking they're just like that migraine and headache. After that we came to know that they've been having a severe heart problem, and we are advising them to come to the clinics to go undergo the various tests, like we are performing them as a stress test as well as the echo, and there is a need means we are taking them for the angiogram. And we found many patients with like a multiple valve, like a closure of the multiple valve disease, and we sorted out them, and by under the government scheme as well as the charity given by the foundations, and we treated them by medication or by the surgery when there is a need. Also, apart from that, we found even the for case of pediatrics, many patients they bring their own child to that, but most of the children are there in the anemic. So what's happening? What is the reason of anemic? Means they don't know the proper nutrition diet what they have to give for the child. Like there will be only the high dose of the carbohydrate they will give. They don't know the importance of the protein and vitamins. So all these things, when we conduct the clinics in the rural area, we have the food pyramid, and we'll explain, our dietitian will explain them what is the importance of the greens the children has to take, the carrot and good vegetables. Even though they are cultivating the vegetable in the village and they are just selling to the cities, but they are not using it for their own life, for themselves as well as for their children, and they don't know awareness. That is the problem with them. So when we conduct these clinics, we will explain them this is the importance nutrition food things what you are cultivating. We are having the nutrition things in the city side, but you are not having it. So definitely you should keep some portion for your child as well as for your family, which will give you a good nutrition value. So all these things we will explain. Also we will explain about they have to take the medication like anti. So these are the things, many things we are covering in the villages. Also the cancer, like many patients we newly diagnosed the cancer, then we are we have a doubt with whether the patient is having a, so we'll send them, we'll ask them to come to the center. We'll undergo the various tests, like sometimes the patient with many breast cancer is more and more predominantly is going up even in our place, and we'll ask them to come for the mammogram screening. And we found out many patients having a cancer, but they are not explaining because they feel shy to explain to the doctors what is their problem. After that come to the hospital, we found them, yes, there is a problem for you, and we asked them to undergo the test. Also if there is a need of a chemotherapy, they will see our medical oncologist, and based on their suggestion we will provide them a care center under the government scheme as well as the charity from the PDM or from the hospital as well as from the Canadian Sharing. Thank you.
Well, thank you, Professor Balaji, for that explanation.